Hello, my name is Peter Watson. I am the Vice President of Clinical Operations and Strategy at Health Alliance Plan. I'm a general internist by background and also work as a physician within Henry Ford Health. Today, we're going to be talking about a very important topic with a condition called sepsis. Sepsis, as you may have heard in the media or maybe from family and friends, is a really serious clinical condition and in many circumstances can be a major public health threat. It is not uncommon for sepsis to be commonly diagnosed within the hospital. And every year, there are somewhere around 19 million cases worldwide, with millions in the United States. Fortunately, we have made much progress in the management of sepsis. It's a clinical infection condition that can lead to very serious harm, but our hospitals, including those at Henry Ford Health, have made tremendous progress in improving our outcomes for those that are hospitalized with this condition. And more recently, our experience with COVID-19 has really heightened our awareness of the importance of sepsis and sepsis management. And we are very fortunate today to have a clinical expert with us to help us explain a little bit more about sepsis, what causes it, how we treat it, and most importantly, how we may be able to prevent it and improve our outcomes from this condition. So today we have with us Dr. Jayaprakash. She is an emergency room physician, but also has specialized training as an ICU physician. So she rounds in the intensive care unit and really managing sepsis is a part of her daily practice, both in the emergency room and in the ICU. Additionally, Dr. Jayaprakash leads our sepsis program for Henry Ford Health and really spends most of her days thinking about ways to improve outcomes for our patients and also for our HAP members that are hospitalized at Henry Ford Health hospitals. So, Dr. Jayaprakash, thank you for joining us.
Thank you so much, Dr. Watson. It's a pleasure to be here today.
Great. Maybe we can start out a little bit by you explaining a little bit more about what sepsis is and a little bit about some of the things that you see as a physician when people are admitted with this condition.
Sure, absolutely. So, sepsis is a condition. It results when the body has this overwhelming and life threatening response to an infection. And this response leads to tissue damage, organ failure, and even death. Sepsis is a condition where you need to have an awareness, a heightened level of awareness, because it can progress. And so catching it early and recognizing it is really important for the condition.
Great, thank you for that. And of course, lots of folks get infections every day. Some of these can be pretty minor. Can you tell us a little bit more about how is sepsis different from any other type of typical infection?
I think that's a really important question. Infection occurs when viruses, bacteria, or any other microbes enter the body, and they can begin to damage the body's cells. Signs and symptoms of infection can appear as an illness and cause you to feel unwell. But in response to the infection, our body's immune system springs into action and it begins to start releasing defense mechanisms into the bloodstream in an effort to try and fight the infection. That's when sepsis has the potential to occur. It's the body's immune response. And it's when that immune response is going out of balance. And that's a process that's occurring, which results in the triggering of changes. And it's these changes that will lead to multiple organ systems being damaged. So, sepsis as a condition results from infection. And yes, it is more serious. It's a more serious condition because it's life threatening when organ systems are damaged.
Thanks for that. And I think we talked about a little bit earlier how common this is. So, in your daily practice and when you're seeing patients, how common do you see sepsis in the hospital?
Sepsis is very common. In my practice as an emergency physician and an ICU physician, the majority of patients that I treat end up having sepsis. In the United States, 1.7 million people are diagnosed with sepsis each year. If you think about it, that's about one in every 20 seconds. Sepsis remains one of the leading causes of death in US hospitals. One in three sepsis survivors will go on to die, and one in six sepsis survivors end up with serious comorbidities that can be long lasting.
Hmm. And I think that really highlights the importance of how we sort of determine when somebody has sepsis, right? Because it is a common condition. So, what are the things that you look for, Dr. Jayaprakash, in sort of determining when somebody has progressed into sepsis?
You know, the Sepsis Alliance is a group that has a great acronym to try and help recognize some of the symptoms that may indicate sepsis. They use the acronym TIME. So T is for temperature changes, and that can be either a high temperature or a low temperature. I is for infection. So this could be a urinary tract infection, pneumonia, for example. Sometimes the source of the infection may not be as clear. M is for changes in the mental status. So, say if you're becoming more sleepy or it's difficult to wake, are you more confused, for example? And E is for when you're extremely ill. This can range from things like severe pain, difficulty breathing, or even low blood pressure. But that acronym TIME is a good way to think about some of the symptoms that can present as in the first signs or in early signs of sepsis.
Yeah, I think that's a great tool. I think the time sort of acronym is important not only for patients but for caregivers. And one of the things that you mentioned that jumps out to me as an internist is we often think about high temperatures like fevers in children and adults, but that low temperature that you pointed out is also extraordinarily important and can be a very serious early sign. Particularly, I know in my experience with elderly patients, can sometimes present with hypothermia or that low temperature in the setting of infection. So again, that time acronym is great as a helpful tool. And once folks are in the hospital, are there certain types of tests or things that you do to diagnose sepsis? What can a patient or family can expect maybe if sepsis is suspected? What things are going to happen in the hospital to diagnose it?
That's a great question. Is the diagnosis of sepsis is really about putting the story together. What is happening, the physical examination findings. Sometimes there are laboratory tests that we put together, but really we're looking for signs like fever, we're looking for low blood pressure, an increased heart rate. We're looking for signs that might suggest difficulty with breathing. We're looking for confusion, changes in level of alertness, and we're comparing it to what a good day looks like when you're not sick. We're looking at blood tests that might help us gut thinking about sepsis, trying to figure out which organ systems have been affected. Depending on where the infection is that triggered sepsis, we may need to use x rays or other tests like CTs. So it's really about piecing the story together and looking at different tools. Sepsis can affect lots of different organs, so it doesn't always look the same from patient to patient. But just thinking about it, knowing about it, and raising our level of awareness about it is what helps with the early detection of sepsis.
Yeah, I think you raised some important points, and I'm glad you walked through some of the testing because I think that families aren't always sure of why certain tests are being done. And again, putting that story together, finding that source of infection and how to control it is important. And I think that leads us into sort of the next stage. So once you've sort of diagnosed somebody, how are we really treating sepsis when they're in the hospital? What are the tools that you're using to do that?
That's a great question because sepsis is truly a medical emergency. And the goal is to treat it as quickly and as efficiently as possible. The clock starts as soon as we think about sepsis or that sepsis is identified. And the key to treatment is rapid administration of antimicrobials, We look to get any cultures to try and find the source, and then it's all about trying to control that source. It includes getting a sense of how severe the sepsis is. We've talked about how different organs can be damaged and how that can progress to even death. So, getting a sense of how bad is the sepsis? How severe is it? It includes rapidly administering fluids if the blood pressure is low, or if we see signs of the most severe type of sepsis, known as septic shock. The treatment depends on the degree of the organ damage. And so treatments might sometimes include needing oxygen. It might be, in the most severe cases, a ventilator to help with breathing. It may include giving IV medications because the blood pressure is low. It might include going to the ICU. At Henry Ford Health, we have a team based approach about thinking about sepsis and acting now. Because the idea is that for the severest forms of sepsis, the medical team needs to come together at the bedside with a goal to identify the condition early, jump on it, and try and treat it early. Sometimes the condition worsens despite this approach. And that's when we know that escalation of care or going to the ICU may be needed. But in many cases, if we can detect it early, we can help prevent dying from sepsis.
Now, I think those are really important points. So obviously, sepsis is incredibly serious, thus the importance of identifying early and also being very aggressive with treatment early in the course of the hospitalization. So, Dr. Jayaprakash, we've talked a little bit about how to identify sepsis, how it's diagnosed and treated. Who are the folks that we're most worried about who may be at risk for sepsis?
Typically the very young and the elderly are the ones that are most susceptible to sepsis.
And any other particular groups that we should be thinking about? I worry about folks who may be on medications that bring their immune system in check, or have lowered their immune system. Other sorts of groups that you think about when they come into the hospital that you might think sepsis is a higher risk.
Yeah, I think those with chronic conditions such as diabetes, high blood pressure, lung disease, kidney disease, cancer, HIV, these are known risk factors for developing sepsis and having a more severe form of sepsis. There are some racial disparities that we've seen when we talk about a sepsis. Nationally, we know that American Indians and Alaska Natives and the Indian Health Service are 1.6 times more likely to die from sepsis than the national average. Black and Hispanic patients have a higher incidence of severe sepsis as compared to white patients. Black women have more than twice the risk of severe maternal sepsis as compared to white women. And there's disparities when it comes to children as well. Black and Hispanic children with severe sepsis or septic shock are approximately 25% more likely to die than non Hispanic white children.
So I think those are really important points. And I know in our local population here in the Detroit area, uh, we are focusing a lot of effort. I know both HAP and Henry Ford Health were doing a lot of programs to try to narrow these disparities and outcomes for some members of our community. And certainly, it sounds like sepsis has a very deep impact in some of these different racial groups, in addition to some of the age groups that you talked about. Um, I think we've talked quite a bit about sort of identification and treatment. Let's talk a little bit about prevention, because ideally, with all the great improvements that you've been doing with your leadership at Henry Ford with the team-based approach, we've made great improvements in reducing death from sepsis in the hospital. But the best way, of course, I think you and I have talked about is what can we be doing in the community or before that hospitalization to even avoid or reduce the risk of sepsis in the first place. So, thoughts on that?
I think that's incredibly important. And it starts with knowledge is power when it comes to sepsis. Having an awareness of how severe this illness can be and seeking help when you're worried about sepsis is key. But in terms of avoiding sepsis, I think there are some key steps that you can take. staying up to date on age appropriate vaccinations, managing chronic conditions. So we talked about diabetes, heart and high blood pressure, lung conditions that are risk factors for severe sepsis. But staying on top of those chronic conditions and keeping them under control help the overall health of the and the condition if it were to develop. Prevention of infection. Infection is the trigger of sepsis. So, practicing good hand hygiene. So, hand washing is a great strategy for preventing infections. We saw that with COVID-19, for example. Masks, they help reduce the transmission of infections. Caring for skin injuries or breakdowns, wound infections. These are portals of entry for infection to get into the body, and that can then potentially lead to sepsis. Being aware of the signs of early infection and working with your primary care physician for early diagnosis, for monitoring and treatment. And staying on top of your nutrition, thinking about ways to maintain a balanced diet can also be a key strategy to help prevent or uh, fight the severity of the condition if it were to set in.
Yeah, I think those are important points. A couple of things I'd like to reemphasize, certainly for us as a health plan at HAP. I think we've all learned the value of immunizations, and we've worked very hard. I know jointly between HAP and Henry Ford with helping vaccinate our community against COVID-19. We're in September right now. We're moving into the flu season, so obviously vaccinating for our upcoming flu season is incredibly important for those at-risk folks. But I also want to reemphasize the importance of those standard adult immunizations and childhood immunizations for those infections that can lead to sepsis. So, pneumonia vaccine for our elderly patients or those who might have immune compromise. Even getting vaccines for things like shingles, which can lead to bad skin infections, which can then lead to issues down the road. And of course, for all of our childhood immunizations, and we're unfortunately a little bit behind a little bit with our childhood immunizations because of COVID-19. So we've been talking a lot about adults, but children, as you mentioned earlier, can also be at risk for sepsis. So really focusing on those immunizations is extraordinarily important. And then I think the chronic conditions that you pointed out, particularly diabetes, is one of those conditions that really put people at risk. But some of the other conditions you mentioned, like heart failure, as well. So again, making sure we keep up on your medications and keeping those chronic conditions in check is so important. So thank you for that. Um, any other thoughts on sepsis, Dr. Jayaprakash, that we should think about for our community as we move forward?
The knowledge around sepsis has grown a lot over the last couple of decades, and Henry Ford Hospital has the privilege of being part of the story of changing modern sepsis care with Dr. Rivers's publication of the early goal-directed therapy trial. But we have a long ways to go in continuing on this journey. The goal is to save lives, and in order to do that, we really need to partner as a community to think about improving our health with the chronic conditions like we talked about, but also being aware and sharing from a patient's perspective. Don't be afraid to share what you're feeling. If you're not feeling right, sometimes the subtleties that it may not feel like it's important to share that you're not just not feeling right, you're feeling a little confused, but that's an important key part of the puzzle for me as a physician when you come into the emergency department or the ICU to help think sepsis and then act early to help get you better.
And I think on that last point, I think that's incredibly important to make sure that our patients, our HAP members feel empowered to speak up when they're not feeling well, talking to their caregivers, the people that are helping take care of them, their primary care physician to identify those things early. And certainly, we're proud to work with Henry Ford Health in creating an environment where folks that are maybe in our plan or seeking care through Henry Ford are able to maximize their services to take good care of themselves and prevent this serious condition in the future. So, thank you, Dr. Jay Prakash, for joining us today. I think this is an incredibly important topic around sepsis. And of course, we're proud of our partnership with the health system to maximize our outcomes. And we appreciate you joining us to learn a little bit more about this condition and look forward to hopefully sharing more information with you in the future about other conditions. Thanks very much.
Thank you.